Welcome to What's Up, Wichita. We're here with host Mayor Brandon Whipple. Today we're talking with Mary Jones with the Mental Health Association of South Central Kansas. If you have a question for the mayor, please email them to social@wichita.gov and he'll answer them on next month's show.
Hi, this is Mayor Brandon Whipple, and I am here with Mary Jones, the CEO of the Mental Health Association of South Central Kansas. Mary, thanks for being with us today.
Thanks, I'm glad to be here.
Of course. We wanted to chat with you about not just the services that your organization provides, but really also one of the things we hear about with COVID and this past year of dealing with COVID is a rise in situations that involve mental health. So I'm hoping that we can chat with you about the organizational services you guys provide, but also just this topic in general, because I think it's one that people are very interested in.
Yeah, absolutely, and I can start there if you like. What we've always talked about is the incidence of mental illness across the community is the 1 in 5. Sometimes we believe that's underreported and it's closer to 1 in 4 adults experience a mental illness in their lifetime. With COVID, what we've seen are exponential increase in rates of anxiety and depression. And among our youth and younger folks, we're talking about increase in suicidal thought. Oh, wow. And so that for us becomes sort of an alarm of how can we reach out to people who maybe are more isolated right now and connect with families and caregivers, schools, to ensure that there's appropriate resources to identify those needs.
So, and that's interesting because we know COVID, I think, is hitting different age groups differently. When we talk about young people and the troubles that COVID has on their mental health, is some of that also because they might not be in a school setting, and if they are in a school setting, maybe a counselor can see some signs, or is it just something that, a spike that's really due to this pandemic?
Yeah, I think that's a really great question, and there's a lot of factors that we're trying to identify around, even at the national level, exploring what's happening with our youth. Without COVID, suicide's the second leading cause of death between those 10 to 34. That wow. is, I know, a staggering thing for most people to hear.
Right, yeah, that is. I would never have guessed that. Wow.
Yeah, and so what we've seen with COVID, when we hear about increased thoughts of suicide or self-harm, what we're really looking at is that, most people are very social in nature and they need to connect with others. Youth and teen are even more so. Their brains are developing by being social and engaging with others. And when you take away school settings, you take away a lot of the safety nets that are there for kids. They spend a lot more time online, and sometimes that's not a good social network, and they can experience things like increased isolation, maybe bullying, those kind of things, and don't have an outlet if they don't have someone who's kind of checking in with them.
So if there are parents watching, what would be some of the things to look for? Like what advice would you have for parents who might have a child who's really life has changed quite a bit with the pandemic, and what would be some of the things that parents should be looking for? And if they see these signs, what advice who should they reach out to?
Sure. The number one thing is a change in behavior. So when you're talking about teenagers and young people, sometimes their moods fluctuate anyway, but think about change in behavior, particularly changing grades. Now, again, that's something to pay attention to because we have hybrid learning and remote learning and some different things that are happening right now that might not always have been the case for those youth. But look for that, look for change of friends, look for isolation, and sometimes verbalizations that are different, crying or wanting to spend time alone and not around other people in the family or in their friend network. Those are all things that would be an opportunity to, number one, talk to your child. That's the very first thing to do, connect with them, what's going on, let them know that it's safe to talk. And then if you're really concerned and don't feel like you can do that, reach out to a professional. For a lot of parents, the easiest connecting point is their primary care physician because that's someone they know and they trust and they have a relationship and they can pick up the phone and call. For others, some are more comfortable with calling a place like MHA or a place that provides mental health services to say, what do I do? And let us kind of walk you through that.
Okay, so if you so reaching out to a medical professional, and but before taking that step, also communication is.
Yeah, talking to your kids. I think sometimes, especially if we felt like there might be something a little bit more going on, like a suicidal thought or some self-harming behavior, as parents, that can be a very activating kind of thing to happen. It can be very anxiety producing. And so sometimes that creates a hesitancy instead of just saying, hey, I'm concerned about you. What's going on? Can we talk? And not all youth are open to that and might kind of shut down, but you've reached out and let them know that you're noticing something and you want to make sure they're okay.
Oh, wow. So switching gears here, and that's great advice. We're also seeing a lot of folks who are of that high-risk population of having really bad results if they get COVID. I think the 65 and older, 70 and older population that probably are even more so isolated at this point. If I can't go see my mom right now or my grandfather because I don't want to accidentally infect them with COVID. What is the effects happening on some of our senior citizens, and what can we do to I guess be as helpful as we can?
Yeah, the senior population has always sort of been at risk for isolation and loneliness, and we even have particular services in our own organization to help keep seniors connected and in their community. With this, then, that feeling of isolation has just become so much greater. So really for families and friends, it's like reach out, even though they may not understand all of the technology, even keep the phone calls coming. Make sure that you can connect. I've seen people do really creative things, drive-bys and all those things, but just making sure that they still know they're important in your life right now, I think that goes a long way.
Yeah, I tried, I think it was Thanksgiving, to have a Zoom meeting with my grandfather, who somehow found himself with a Chromebook and trying to get him to turn the volume on because he couldn't hear me, and just walking through those steps and how tough that was. But in the end, it was great, and it's just it just makes you think. When my job, I talk to providers who drop meals off for our retirees in our community and our elderly folks, and just having that interaction, that might be the only interaction they have, and just with COVID, I think that it makes it so even less interaction. So what else are we seeing with not just the pandemic, but even now coming someone out of the pandemic that has to do with mental health that we should be aware of?
Well, you mentioned something that we're still, there's some research that's coming around the mental health effects of COVID. So we talked about, we hear a lot about the long haulers or long-term impacts neurologically, physiologically with COVID. People are having more incidents of stroke and blood clots and things that they're still trying to understand a little bit better. But there's also some research that's indicating, again, about 1 in 5 of people will experience a mental health issue post-COVID. So that's something to kind of I'm more interested in. I'm beginning to read some articles around that. What causes that? Is that an impact of what we're seeing with the pandemic, or is it biologically rooted in another impact of COVID? So there's some things we're kind of watching there.
That's interesting. So it might not just be physiological. It might not be an after effect of the long term or long termers. I think effect of COVID. It's actually in response to the pandemic. So is it anxiety, or is what are we?
Well, I think there's a few things that are going on
for survivor syndrome, or
sort of like an anecdotal, not research based. The people I've talked to who experience, you've heard people talk about the brain fog that happens, right? And so there's almost this depression that it feels like people are experiencing, anxiety about getting out in public. We're seeing a lot of that. But this particular thing I'm talking about, I think, is related to actually mental health issues that are sort of post-syndrome of COVID. So I'm not quite sure. Again, I need to find out a little bit more, but it's interesting to find out. We just don't know enough about the long-term impacts of this disease.
NPR almost a few months ago, COVID time, it all kind of blends together, but a while back, NPR did a story about medical professionals and medical professionals who have just been under an intense amount of strain. Being on the phone with some of our hospital leaderships, they've described to us that some of their folks have seen 2/3 more death this year than ever before. in their careers, and the mental health effect this has on medical professionals. Should we be more concerned about coming out of this with our medical professionals, and what we could be doing as a community to be more supportive?
Yeah, absolutely. I think right now, because we're sort of in the trenches with it, we're not seeing the medical professionals reach out. What I anticipate is what we're starting to see in the general population, which is more people are saying, I need to talk to somebody. There has been too much. I've experienced too much. I've been isolated too long. But there's a real impact to the trauma of when you hear the medical professionals talk about it like wartime trauma, that they are seeing things that they've never had to experience, the shortage of staff, just the trauma and the death, and families not being able to be there with their loved ones when all this is happening. It's very likely that you could see this types of acute stress disorders or even a post-traumatic stress disorder when this is all said and done. So as a community, I think what we can do is what we try to do every day, which is fight the stigma around it and
Right.
acknowledge the fact that people are suffering and it's okay to seek treatment and help. And that isn't a sign of weakness. That's a sign of, I have a health condition and I know I need to get treated for it.
And you're saying that 1 in 4 or 1 in 5 Americans have
A mental health issue.
a mental health issue, and so that's pretty common.
It's pretty common. I mean, I think all of us could say, if not for ourselves, we know somebody with anxiety or with someone with depressive moods, and we don't really think much about it. But sometimes we are self-stigmatizing too. Like, I don't want to be the one that goes to my doctor and says, I'd really like to get some medicine for this, or I'd really like to talk to somebody about what I'm experiencing. And when we don't talk about it, we limit ourselves and we limit the possibility for other people to learn about it's common, and it's not unlike any other illness. So if you suffer from migraines, you're going to go see a doctor about it.
Or drink a lot of coffee.
That's right. Yeah, you might do that. But we don't stigmatize health conditions except for mental health conditions. And so I think we've come a long way. And one thing I would say that COVID's done is elevated the talk about mental health in general. And so that's an opportunity for us to say, yeah, let's talk about mental health. It isn't just because of the pandemic. It was here before, but the pandemic has definitely had an impact on mental health issues. So let's talk about it.
Yeah, do we assume, and it's pretty, I think, common or easy to understand why during this particular time frame when there is concerns with health, we have this invisible virus that could, I guess, we could catch at any moment. Plus the economic uncertainty, with all of that hopefully behind us, right? Like once we get the economy going again, the vaccines going, hospital numbers down, we're seeing improvements in treatment. Do we expect, or as a professional like you, expect kind of that prolong, we're out of the real, I guess, situation, but now you're thinking back on that post effects of this pandemic?
Yeah, I think there's a lot of places where there'll be good recovery economically and socially. Things will open up and people can go out to eat and see their friends again. But it will be noticeable that there is going to be a long-term effect of, do I shake your hand? How close should I be? Should I really be out doing this or that? I mean, there's this kind of lingering anxiety that I think we'll see people experience. We'll also have people that, particularly again the youth, that'll need more social opportunities to recover. And this is also something that I think we need to be concerned about. Is there's quite a bit of health disparity among people in all sorts of conditions. Mental health is no exception. So the opportunity for us to just not assume that everyone rebounds in the same way, it's an opportunity for us to get to those communities and really address the health disparities that have existed.
So if someone's watching this right now and they're reflecting on their own responses to the pandemic and might feel that they have some mental health issues that they want to address, what do you recommend to them?
Well, first of all, good for you, because you've observed something in yourself that might not be exactly right. Again, for I think a lot of people, that first phone call is a friend And that's a great place to start. Call a friend and say, I'm just experiencing this, or I don't feel the same, or I don't really feel like getting out and doing anything, or just don't have the energy, or I'm not sleeping well, or my eating's changed. All of those things, reaching out to a friend. Again, a lot of people feel comfortable with a doctor because that's a known established relationship. So call your doctor. That's a good step. But there's also places like ours that you can just call and say, this is what I'm experiencing, what do I do? And our agency, like many other mental health agencies, will help navigate that with you.
So let's expand on that. Let's talk a little bit about what the mental health you
can just say MHA.
Yeah, Mental Health Association of South Central Kansas. What services does the organization provide, and how could folks get tapped into those services if they need them?
Well, our agency is unique. We are a nonprofit in the community. We've been here since 1957, and so we do everything from prevention through treatment. So we have programs that can link people with just learning about social and emotional health to treating it at the very end, when there's a clinical issue, and everything in between. Mm-hmm. And we also serve all age groups, so we have kind of something for everyone, because our belief is that mental health isn't a point in time, it's across the lifespan. Mm-hmm. So from as young, from birth and prenatal care to when you're a senior and you're dealing with those sort of late stage life issues, that your mental health should always be addressed. So there's lots of things we can do, from clinical services that people know, like therapy and substance treatment and medication, but also services just to teach people about how they can take better care of themselves.
Oh, excellent. And if they wanted to get in touch, you guys have a website, or should they call, or what's the best way to reach out to your organization?
MHASCK.org is our website, and you can call our number at 685-1821, and we'll get you hooked up to the right place.
Excellent. Well, Ms. Jones, we really appreciate you being here and talking to us about this very important topic, and also the services your organization provides.
Thank you for having me.
Of course.
Sweat and tears, I've invested in this game, so I lay it on the line because I come to do my thing. I'm definitely in my zone, transforming the beast mode. I'm showing up and I'm balling out, and I run this game with no cheat codes. I'm mounted up and I'm ready to go. Victory is mine, I ain't letting go. Believe that, I receive that, it shall come to pass as I said. So if you want it, come get it. Better come with it. I'm on fire, and don't you forget it. I hope against hope. Ain't no situation hopeless. Got the game on lock. Man, my focus got focus. I give my all to.
A Wichita family recently found out how easy it is for accidents to happen on icy ponds. A mother and her 2 children were visiting a local park when her 10-year-old fell through the ice. The mother went in to help, but she also fell in and was followed by her 2-year-old child. Fortunately, everyone made it out okay, but it could have ended up much differently. Please make time today to teach your families about the dangers of icy ponds and lakes. Remember these 3 points. There is no way to judge the strength and safety of ice based on appearance or temperatures. Please stay off the ice. Never leave children alone near ice-covered bodies of water, and keep pets on a leash so they do not wander off. If a person or pet falls through the ice, do not attempt to rescue. Call 911 and go for help. Please help us get this message out. It could potentially save a life.
Well, Mayor, thanks so much for doing this again. We've got a couple questions, and one gets a little bit political. So are you ready?
Oh, yes. I think I'll be okay.
All right. This is not the political question, but it it is something that we've been talking about in our community. Could you provide an update on the ethics policy for us? What are the next steps?
Yeah, really the next steps are pretty laid out. We had, 7 months ago, we had a retreat where we talked about and kind of laid down the foundation for our new ethics policy, and came out of that saying we want one of the strongest policies in the country. As was it 2 weeks ago, or 3 weeks ago, I don't know. We had a workshop, and it was really kind of getting into the details. What we're into now is pretty much consensus. We need a four-layer policy, which makes it one of the best. It would be code of conduct, an officer to help organize complaints and also give advice for members who have questions, a impartial board who hopefully would rarely get called, who would have to decide if a complaint is legitimate, if someone is accused of anything, and then also a whistleblower policy. And what we're doing now is we now have that framework, and we are working with the National League of Cities and some of their staff and mayors who have gone through this process before to help create a more robust policy moving forward while taking in the feedback from our DAB boards and the public. So it's moving along. I think the target is first week of May to actually have a vote on the final bill or legislation or ordinance, whatever you want to call it. Sometimes I get dinged for using these words interchangeably. But hopefully in May we'll be done with this part of the policy and working towards other policies.
That's great. And then what's the next opportunity for the public to weigh in? I think we have a social media town hall coming up.
We do. So really weigh in when you feel called to weigh in, right? Like when you have a moment, shoot us an email. Whoever your councilperson is or me, shoot us an email telling us what you think. But as far as a more structured meeting, the DABs will be meeting on this topic. You can show up to a DAB meeting. And I want to say, and I'm not going to say the date actually because I'll probably mess it up, but in the very near future, follow us on social media, there will be an official town hall. So again, and we're talking about ethics in the framework of a actual policy that pretty much is the bumpers for electeds and people who want to interact with the city to keep everyone kind of on a level playing field. We're not really talking about, I guess, the moralism, like the philosophy of ethics. So we're looking more for input on if there's any concerns that citizens have with any type of behavior that they've seen out and about, really, and to make sure that doesn't happen here in Wichita. Bring that to our attention so that we can ensure that our policy would have the least amount of holes in it.
Great. All right. Our next question is about aid to people who are hurting in our community. A lot of people are waiting on the next stimulus check. Mm-hmm. What opportunities do they have to seek help before that hits?
It's a really good question. First, if you're watching this show, then hopefully you've seen it before and possibly can get on our YouTube channel, watch other episodes where we talked to folks from United Way about the services they provide. So first we'd say call 211. That's United Way, and if you're someone who's looking for, let's say, food assistance or you're looking for any type of service, United Way is really good at giving people into the right direction. Also, at the city level, we just got a $12 million federal, I don't know if it's a grant but it's federal money coming in, and it's to help people who are struggling during COVID, struggling with rent, struggling with utilities, and we are about to launch this program that will allow landlords and also tenants come and show really just documentation that they've been economically hurt during the COVID economy. And if they qualify, they can get utilities paid for, get rent paid for. This is federal money, which means that we want to spend it all. We're not cutting any programs for it. And we do better as a community when our neighbors can stay in their house. We do better as a community when people don't have to spend down all their savings because their job right now isn't up and going like it normally is due to COVID. So we want people to take advantage of that. My advice is to first call 211 and then also check out the stuff that our housing department's doing. I think we had a show where not too long ago. You can check out the one with Director Stang. She's great. She talks about this program and other programs we have.
Awesome, thank you. All right, so we have a final question. It's a little bit political.
Oh, no.
I'm not sure if you want to actually answer this one because it might get some people upset.
Okay.
But the question you got was, do you prefer hummus or spinach and artichoke dip?
Oh my goodness, this will get me upset. I mean, people upset, to be honest. Like when I thought you were going to ask me an easy Democrat versus Republican question.
No, this is the real issue.
So I got to be honest. I'll take a stand on this one. It is artichoke dip.
Oof.
I know. I'm not sure if we could be cool after this, but the artichoke dip. I grew up, and my dad cooked. My mom worked nights at a restaurant, and he grew up in like this Italian neighborhood, and it's all Italian stuff. And so artichoke is actually on the menu. And you know, here the only place I can really get artichoke here in Wichita, since I moved here after I turned 21, was really an artichoke dip. So I'm actually a big artichoke dip person because it reminds me of growing up and my dad would cook an actual artichoke, which is a very weird plant, by the way, but we have it as part of dinner.
Well, great. Well, thank you. That's all we have this time.
Thanks for watching this episode of What's Up Wichita. I try to be as responsive as I can on social media, so be sure to reach out to me there or email me at bwhipple@wichita.gov. If you want to ask a question on next month's show, please just email the question at social@wichita.gov. You can even send us a short video and we'll play it on the air on the next episode. Thanks for joining us.